So you're experiencing burnout in your first week, month, year having foster care children. 50% of people quit in the first year. There's a lot of turnover. Why do you think that is?
Because people get into becoming a foster care provider and think that it's going to be, oh, we're saving the kids, and they put their all into it, and then they realize like what the system is actually like, that you're doing most of the work. You're not getting the help, the support that you need for yourself, for the kid. Um also some people get into it thinking that it's going to be like a rosy situation where they're just going to
Mhm.
find the perfect child with no issues whatsoever, and they're just going to be able to go through the process very simply and go through to adoption and have it be all over and have a happy family. And that's not reality at all.
We're providing because we are foster parents who have adopted three of our foster children. You may think you have a perfect home and expectation, your expectation should just be followed. And I'm kind of laughing because there's a lot of behavioral issues that come up, and I think we should talk about how emotionally draining this process is. And at home, how emotionally draining this is, which is why people really get the burnout, right?
Well, part of it is dealing with the child and the issues that come up. Again, it could be mental health, it could be behavioral, it could just be because of them, being so traumatized that, they're acting out because they don't understand the whole situation. No one's sitting there explaining to them, oh, okay, Johnny, we're going to take you to this person's house and, you're going to stay here and this person's a nice person. They get no information about you. They don't know anything about you. They come in your home and they are, just as clueless about you as what you are about them. So, I mean, that in itself is traumatizing.
Mm.
You can't expect a child that's been traumatized just walking in your door, traumatized from their, situation that they were removed from, to instantly, follow all the rules and be the good kid and sit there
Mm.
quietly and watch TV and not play with anything in your house that you don't want broken and all of those things. There, it's not going to happen. That's not a reality. It's not so much that they're behavioral issues. It's more, when you break it all down, the trauma, the mental health, the whole situation, it kind of like in a ball. You're not going to dissect it and say, okay, well, this child has this issue and they need to go to, to get help for this issue. And then go to DCP&P and say, oh, okay, this child needs to see a psychiatrist or go for some kind of therapy. They usually don't go for that. Like our son that came with us and had, reactive attachment disorder, when he walked in the door, literally it took me a whole year to fight them. I kept track in a notebook of everything that happened. I had videos, I had pictures, the
Mm.
way he was acting. And yeah, they're saying that's all behavioral. Yes, he went through trauma. Yes, but you also cannot expect a child to go through all of that and not understand it. You're the foster parent at that point. We didn't, we weren't adopting him yet. The system, that's where the system fails. The system should have systems in place to help with things like that, to help like ABA, behavioral assistance, ABA assistance, um, psychiatrists, psychologists, any kind of, help that they can offer mental health wise for these kids. And they don't have that. They try to act like, oh, well, they were just traumatized. It's okay. Once they become comfortable in your home, things will even out and you'll be okay. And, don't worry about it, because they don't want to handle it. They don't have the information, the the things that they need to put that in place.
Let's talk about the parents. The burnout is on our side. I'm not sure the children themselves are burnout. It's the foster parents that get burnout from how difficult this is, the listening or lack of listening that you may experience, or just rule following, accepting consequences, especially when your child isn't an infant or one anymore. That's difficult for the parents. I mean, if I want to quit, if it's just too difficult, what do you have to say to that?
Well, it's not just the behavioral end of it. It's the fact of, if you're going to be a foster parent, you have to understand that you're given this child with no information. You're the one that is living with this child day in, day out. You need to figure this child out. You need to figure out not only like behaviorally what their issues are, mental health wise, physically, that's exhausting right there. Then you have to, normally take care of this child, maybe get them, dressed and ready for school and activities after school, and, like a normal situation would be with a child. But then on the other end, you also have to fight DCP&P. You will have constant phone calls every single day from caseworkers, nurses, supervisors, um, the person that takes the child for the visits. Then you have to factor in the visits and figuring out like where they're picking the child up from, what time's the child coming home, what happens if, a visit doesn't go, like the parent doesn't show up and the child's already there, like, your schedule. Then, on top of that, again, you have to be the detective. So maybe you throw in some doctor's appointments and dentist appointments and all of that on top of it. Like, it's just like you're constantly going. You don't get a break. You can't stop because it is for a child, a living being. It's not like you can say, okay, I'm just going to take a break this week and I'm not going to do anything that this child needs. That's not going to happen. So, in a way, you have to be able to handle it if you want to be a foster parent. If you can't handle that, the constant having to do things, the constant having to deal with issues, then maybe being a foster parent is not something that you want to do. If you do start, becoming a foster parent, you go through the process, you get your license, say you have children in your home, no matter how many there are, and you have an issue. It's not that easy to make a phone call and say, okay, this child isn't working, I want them removed, and then they come to your house right away and move them out of there. That doesn't happen that way. You have to basically make a case to the DCP&P worker or the supervisor, whichever, you're going to talk to. Usually it does have to go to the supervisor. You have to make a case of like why this child isn't fitting in your home, why they're not fitting in your family, why this isn't working for you. They're not just going to remove the child because, oh, yeah, this isn't working. That's not enough. You have to have a reason, because then they have to start finding another home for this child. And they don't want to remove children from home to home to home to home, because that is traumatizing. So you need, to make a case for it. And then once you make a case, if they agree to it and that, okay, they're going to remove the child from your home, then usually it's kind of like you're leaving a job. You have to give them like a 2-week window. Sometimes they will find a family to, move the child to pretty quickly. Other times you could go the full 2 weeks or more if they don't find a family. There's no like backup family that sits there and waits for, people that can't deal with this child and, oh, okay, we'll take them. That's not reality. They have to find an open bed, an open family. Now, you have to understand too, if a child is removed the first time and brought in your home, they have information now because that like certain things are going on, certain behaviors are going on. You're telling the worker. The worker is going to tell these families, oh, this child has this problem or that problem. So that may make it harder for them to leave you also. So it's kind of like a double-edged sword. Like, you want to figure out what's going on, but you don't want to give all your information in the beginning, because if you can't handle that child, it will make it that much harder for them to be moved.
Once a child is moved and you push for it, should you wait a while? I mean, before you take in another child, because each child is different. You may get some that seem easygoing, and others that have, as you've said before, reactive attachment disorder, and who knows what's going on in the brain. Should you give yourself time between foster children, even though you get the call?
I think
hard.
You should, but that's easier said than done. You can tell them that you don't want to take any kids for a week, 2 weeks, whatever, the situation may be, but they kind of frown on that. So if you do that, expect it to kind of come around the other end where they're not calling you as much, because now they feel like you can't handle the situation with most children. So that you may not get calls, or you may get way less calls than what you did before. If you're okay with that, then fine. Take your break, take however long you want. You'll still get calls because you have your home open. You can't close your home without giving up your license. So if you still have your license, and your home is open, you're still going to get phone calls. Now you can, pick and choose what you're willing to take or not, but you probably will get, for a while, less phone calls, because that will kind of give you a red mark, like, okay, they gave up this child. Are they really able to handle this? You do have a resource worker who is for, like, it's supposed to be a support, kind of like a backup, for resource parents. Each resource family or foster family, however you want to say it, is given a resource worker, assigned a resource worker. You can call them and you can let them know kind of like what happened with the situation. They can kind of walk you through, maybe like you should go and talk to someone. Maybe you should go to a psychiatrist and, kind of decompress. Maybe it wasn't that big of a deal and, you just needed a break or whatever. And they can then relay that to the workers and, kind of lessen the reaction that you would get from them.
Can you, if you find, or if you at home are finding that children, when they're older, maybe behaviorally for you, can you just ask for infants? Would they permit that without giving you the quote red mark?
Well, that is kind of a whole nother situation. You can do that, but I would only do that if I were just fostering. If your plan is to foster to adopt, that's going to look bad on you as you go and as the child gets older, because remember, you could have a child that's a baby coming in your door and they may not get adopted until they're 5 or 6, depending on their situation. You never know when you're going to go through to adoption. So if you're planning on adopting, I would not do that.
Okay.
I would let your resource worker know, because you can, put down in your paperwork, what kind of child you're looking for, what age range, or, whatever. I would let your resource worker know that, but I wouldn't let the DCP&P caseworkers know that.
Okay.
If you're just planning on fostering and that's all you're doing, then I would absolutely figure out, what's best for you, what works for you. whether it's, just infants, whether it's 3 to 5, but you have to understand you're going to have more of a turnaround with that. Because if you say you're going to take a child that's an infant, so at age 1,
Right.
that caseworker is going to know, okay, that child needs to be removed from that home before they hit 1. So they're going to have a plan at like 10, 11 months to move them to a new family. So you have to be ready and know and understand that, like, you're going to have kids constantly coming and constantly going. Now, if you have a wider age range, there's less of a chance of, the coming and the going, but that's still going to happen because the children are still going to reach your max age and they're going to move them to another home.
So for you at home, they've had enough. I want to quit. Is that okay? Should you feel bad about it if that's your decision?
You should not feel bad about any decision you make, because this is a very tough thing to go through. Whether you're fostering, whether you're adopting, just honestly, I was ready to quit after the first year of trying to get approved to get a foster care license. And we still had a whole nother year to go before we got that license, because they make it so difficult. But if that's what you want to do and you want to quit, it's not difficult to quit. You just make a phone call to your resource worker and tell them, we're done. Can't do this anymore. You don't have to explain yourself. You don't have to give reasons. You just tell them that you want to close your home. You want to close your license and close your home. Now, if you do that, you have to know you can't make a split, quick decision to, like, okay, I'm just going to close my home. I'm done.
Right.
That's pretty severe. In order, like, if you change your mind tomorrow, you have to go through that whole process that you went through in the beginning to get a license all over again. So before you make any quick decisions and make any phone calls, you need to sit there and you need to, first of all, decompress, calm yourself down, do whatever you need to do. Yoga, psychiatrist, whatever, talk to a friend, whatever you need to do to clear your mind, and then sit there and understand this is a permanent decision. Just like getting into foster care was a permanent decision, getting out of foster care is a permanent decision. So if you want to get out, you need to make a decision with a clear head.
Now, what supports, if you really want to continue and you don't want to quit, what supports and how effective are those supports that you can get? Are there mentors? What help can you really get if you're experiencing, severe emotional difficulties with raising the kids, or they just came, or what have you?
In New Jersey, there's a nonprofit group called Umbrella. They do offer a mentorship program, which is great. Like, every foster parent should try to hook up with them. They do a lot for the kids. They do scholarships. They basically try to help in every which way that they can. With the mentor program, I was a mentor when we were fostering.
Right.
And I think that's a great program because you get assigned a mentor that, like, they do a whole questionnaire. They ask you what you're having issues with, what you're not having issues with, what kind of child do you have in your home. Like, there's I think it's like 2 pages of questions just to kind of get an idea of where you are, what you need help with, what you need support with. And then they take that information and they try to match you up with the foster care provider, that mentor that has been through similar situations. So that way they can kind of guide you, with what the information that they have from their situation. And that works very, very well. A lot of people get help that way. Another way that you can kind of get support or build your own support system, there are Facebook pages for every state, foster care, related, where you can just talk to other people, connect with other people, so you feel like you're not alone, because a lot of the time in the situation of fostering or adopting, you feel like you're the only person going through it because you're in your house with a child and you don't see the other foster families. You don't see that other people are dealing with similar things. Or maybe the DCP&P caseworkers coming here and making it seem like, oh, well, you're the only one with these issues and everyone else is, not having a problem. So they kind of make you feel singled out. To avoid that and feel like you're supported, you need to try to connect with other foster families,
Okay.
regardless of what their situation is. So that way you can get that support. Also, like, friends and family, I know they may not understand the whole entire situation, but that's a way of getting support.
So that's the end of this episode. If you enjoyed the content, please like, please subscribe, and please leave your comments below, especially if you want to convince my wife, Sherry, and I'm Mike, to be on camera together where you can both see our faces. We'll see about that.